Would you know the difference between a child being tired, distracted, clumsy, or showing a neurological warning sign? Let me be clear, not every headache is a brain problem. Not every twitch is a seizure. Not every delay means disaster. But here's the truth. Some parents wait too long because they are told they'll grow out of it. Sometimes they do, sometimes they do not. And, when the brain, nerves, muscles, or development are involved, guessing can become expensive. Emotionally, medically, financially. This is not a video telling parents to panic. Panic is useless. This is also not a video telling parents to ignore symptoms because kids are just weird. That is lazy. This is about the uncomfortable middle. The staring spells, the severe headaches. The child who suddenly walks differently. The baby missing milestones. The teen with weakness, shaking, fainting, or strange episodes. The parent who keeps hearing, "It's probably nothing." Stop. Probably nothing is not a diagnosis. Nobody tells you this. The biggest danger is not always the symptom. Sometimes the danger is the story people invent to explain it away. Picture this. A 7-year-old keeps staring into space at school. The teacher says, maybe attention problems. A 10-year-old has headaches so bad they vomit and hide from light. A toddler still is not walking, and everyone says, boys are just slower. A teenager has hand tremors, dizziness, and episodes that look like fainting. Different kids. Different symptoms, same pressure. Wait, watch. Do not overreact. Here is the uncomfortable part. Parents are stuck between fear and embarrassment. They do not want to be dramatic. They do not want to miss something serious. So they minimize, they Google, they compare, they ask relatives. But your child's nervous system does not care about family opinions. It needs the right evaluation. A pediatric neurologist is a doctor who evaluates brain, spinal cord, nerve, and muscle problems in babies, children, and teens. They may help with seizures, headaches, migraines, developmental delays, movement problems, tics, weakness, balance issues, neuromuscular conditions, and unusual episodes. But the word neurology scares parents. They hear it and think brain tumor, seizure disorder, lifelong condition. Worst case scenario, slow down. Seeing a pediatric neurologist does not mean your child has a severe diagnosis. It means someone needs to investigate the nervous system properly. The real question is not, is this scary? The real question is, what are we ruling out? Without that question, parents get trapped between denial and panic. Both are bad doctors. Why do neurological symptoms get missed? Because they can look normal. A staring seizure can look like daydreaming. A migraine can look like a stomach bug. Developmental delay can be dismissed as personality. Weakness can look like laziness. Balance problems can look like clumsiness. Tics can look like behavior. And parents are often told to wait. Here's the truth. Sometimes waiting is appropriate. Children develop at different speeds. Symptoms can be temporary, but not every pattern deserves patience. IF symptoms are sudden, worsening, repeated, one-sided, linked with loss of consciousness, severe pain, weakness, trouble walking, developmental regression, seizure-like activity, or changes after head injury. Do not play guessing games. Start with medical evaluation. Stop asking, is my child just being dramatic? That question is dangerous. Ask better questions. When did it start? Is it getting worse? Is it happening repeatedly? Does the child lose awareness? Is there weakness, numbness, confusion, vomiting, severe headache, or trouble walking? Did development stop or go backward? Does it happen during sleep? Is school noticing it too? Did anyone record the episode? Let me be clear, a video can help a clinician understand what happened, not to diagnose your child at home. To stop relying on vague memory during a stressful moment, parents are allowed to document. Parents are supposed to ask. Here is the practical checklist before seeing a pediatric neurologist. First, write down the pattern, time, duration, triggers, recovery frequency, what the child remembers. Second, record an episode if it is safe. A short video can be more useful than 10 paragraphs of panic. Third, involve the pediatrician. They can check basic causes. growth, development, vision, blood pressure, labs, medications, sleep and referral needs. Fourth, know the red flags. Seizure lasting several minutes. Trouble breathing, blue lips severe. Head injury, sudden weakness. Worst headache, stiff neck with fever. Confusion. Loss of consciousness. New trouble walking, developmental regression. Fifth, avoid miracle sellers. Brain supplements, detoxes, neuro reset programs, and fear-based packages should not replace medical care. 6. Track function, school, sleep, speech, movement, mood, headaches, sports balance. Attention, if your child is changing, the pattern matters. Now here is the part people fight about. Some parents say doctors dismissed their concerns for years. Some clinicians say parents are terrified by social media. Both can be true. A parent can overworry. And a child can still need evaluation. A doctor can be careful and still miss a pattern if no one has the full story. Nobody tells you this. Pediatric neurology is often detective work. It is not just one symptom, it is timing, context, development, family history, exam findings, videos, school reports, sleep medication. Sometimes the diagnosis is serious. Sometimes it is manageable. Sometimes it is not neurology at all, but you need a process, not a guess. Reality check. If your child has a seizure-like episode, do not let someone online tell you it is just energy. If your child loses skills they already had, do not let anyone call it laziness. If headaches wake them from sleep, worsen fast, or come with weakness, confusion, vomiting or vision changes, do not dismiss it as screen time. If one side of the body is weak, if speech changes suddenly, if walking changes suddenly, get medical help. Let me be clear, natural does not mean safe. Calm does not mean ignore, and wait and see is not a universal parenting strategy. On the other hand, do not turn every blink into a catastrophe. The goal is not fear. The goal is triage. What is urgent? What needs an appointment? What needs tracking? That is the difference between panic and responsible care. Here is the hopeful reframe. A neurology referral is not a sentence. It is a doorway. Maybe your child needs reassurance. Maybe migraine care. Maybe seizure evaluation. Maybe therapy support. Maybe developmental screening. Maybe imaging. Maybe EG. Maybe nothing serious. Maybe something that gets better with the right plan. You do not have to choose between denial and disaster thinking. You can be calm and alert. You can be loving and skeptical. You can respect your child without explaining everything away. The goal is not to diagnose from a YouTube video. The goal is to recognize when the nervous system is asking for attention. Your child deserves clarity. Not panic. Not dismissal. Clarity. This video is for education only. It does not diagnose, treat, or replace advice from your child's pediatrician, pediatric neurologist, emergency clinician, therapist, or other qualified healthcare professional. Seek urgent care if your child has trouble breathing, blue lips, seizure lasting several minutes, repeated seizures, severe head injury, sudden weakness, sudden speech trouble, confusion, stiff neck with fever, loss of consciousness, worst headache, new trouble walking, or any emergency symptoms. If you want clear pediatric health content without sugarcoating, subscribe. Leave a comment with your questions or suggestions. Tell us if you want a video on seizures, migraines, tics, developmental delays, fainting, or red flags parents should never ignore. In the next video, we'll explore maternity and pediatric nursing red flags that many families think are completely normal.